Hey guys, welcome to Kines 610 Evidence-Based Practice. The topic for today is going to be the hierarchy of evidence, or as some people would call it, the levels of evidence. I had the privilege of listening to Dr. Sydney Burwell one year at a conference, and one of the things that she said to me that stuck out was that her students are dismayed when she says to them that half of what you were taught as medical students will in 10 years have been shown to be wrong, right? And so I'm sitting there like, man, that's 50% of a student's education. But then what troubled me the most is that she goes on to say, and the trouble is that none of your teachers know which half, right? And so as I teach this evidence-based practice class, please know that I am practicing what I preach, that there isn't a day that goes by that I'm not seeking the most current evidence as it relates to this course or as it relates to the other undergraduate courses that I'm teaching. And may this be a lifelong lesson and a lifelong model for you as many of you move on to leave Point Loma and to become either clinicians, practitioners, exercise physiologists, and or educators, right? And so as we move into this lecture, we're going to start with the review of the evidence-based practice cycle, right? And the first step, which we've already talked about in Module 1, is asking the clinical question, right? Evidence-based practice starts here in Step 1. It starts with asking the clinical question, but it's not just any clinical question. Remember, it's that PICO. It's writing a clinical question that incorporates the patient, the intervention, the comparison, also the outcome, and sometimes some say the T, which could be the time and or the therapy, right? So we started there in Module 1. In Module 2, we then moved over and we said, well, how do we, based on our clinical question, acquire the evidence? How do we search the literature? Which search engines would be the best search engines that would yield us the most fruitful results? And then once we have those results, right, then the next step in that process is trying to figure out where those research articles sit in the hierarchy of evidence. And so that's the purpose of today's lecture, is talking about that hierarchy and how to identify or how to classify our research articles so that we know which research articles really truly can help us answer that clinical question, right? And which of those research articles we can kind of throw to the wayside and move forward in our literature search. So I hope this 15-minute lecture is very helpful to you guys. So the evidence-based medicine pyramid is simply just that. It's a diagram that was created to help us understand how to weigh different levels of evidence in order to make health-related decisions or to help us answer our clinical questions, right? And for this class, it's going to be the clinical question that we developed in Module 1, so keep that in mind. It really helps us put the results of each study design into perspective based on the relative strengths and weaknesses of the design. And so I'm hoping I could be your tour guide through this pyramid so that you would have a greater understanding of the types of research studies and where they fall in the hierarchy or the levels of evidence pyramid. So as we approach the pyramid, one thing that we can see is that the pyramid is divided into different levels, right? And each ascending level represents a different type of study designs. And as we move up the pyramid, what we would say is that this corresponds to the increasing rigor, quality, and reliability of the evidence. And so we could say that as we move up the pyramid, the design, the validity, and the applicability of the research study improves dramatically, right? Where we would have poorly designed research articles down here and probably your most rigorous research articles at the top of the pyramid. So in other words, as we ascend through these different study designs, we become more and more confident that their results are accurate, that they have less chance of statistical error, which you've learned in your research methods and designs designs class with Professor A, and that there is minimal bias from confounding variables that could have influenced the results, right? So we're more and more sure that as we move up this pyramid, that we could be using definitely any of these research articles to help really truly answer our clinical question. So we'll begin with the first level of the pyramid. And just like any pyramid, we need a foundation, right? And so the first level of the pyramid is going to serve as the foundation. This background information is important and it's definitely helpful. However, when viewed on its own, right, this type of evidence can be heavily influenced by beliefs, opinions, even politics sometimes. So the reason it is the base or the foundation is because we have to start somewhere. But also keep in mind that this level, the base level, can also include anecdotal evidence, which is really, really subjective in nature. And so again, lots of bias at the base of the pyramid. As we move up the pyramid from the base, the next level is the case control studies or case series reports, right? And so this level represents the first stage of testing and observation, right? It's the base. Someone recognizes something and they want to start to do research on it. So case series reports usually include only a few participants, maybe sometimes even one, who are given a similar intervention and a follow-up, right? And so case control studies are similar to case series. The main difference is that it looks retrospectively, so past in the past, at individuals, and it compares those results with a similar group who did not have the intervention, so a control group, right? These studies are conducted in the early stages of research to help identify variables that might predict a condition. So some weaknesses with this particular study design is that they are very small in the number of participants. And so as you may have learned in Kinesiology 605, your research methods and design, is that this study would be very, very low in power, and it might be very, very high in bias and have confounding variables or factors. So as we continue to move up the pyramid, the next type of study, so as we're moving up, the study design is becoming tighter. The studies becoming more valid and more applicable are the cohort studies, and cohort studies follow a large group of people over an extended period of time, and generally what they seek to do is to show how exposures affect their outcomes. And so this type of study is normally used to look at the effect of suspected risk factors that cannot be controlled experimentally. So for example, the effect of, let's say, smoking on lung cancer, right? These studies are frequently used to determine long-term effects of a lifestyle, diet, and or other interventions. Cohort studies may include a second group that did not engage in the same intervention as a control comparison. So although these studies are set up in reliability and are a step up, in reliability and generalizability, they can be difficult to blind. So it may be the case that you're always going to know which participants were in each of the groups, and they're most often not randomized. So again, they're just a step below randomized control trials. And so the last research study in the unfiltered information group are the randomized control trials. And so we've reached a major point in the pyramid, right? The randomized control trial, the true experimental design. In this study design, individuals are assigned by special randomization techniques into at least two or more groups. In this study design, one group is going to receive an intervention, and traditionally speaking, the other group receives no treatment. They could receive a placebo treatment, or they could receive what is called the gold standard or the standard intervention, right? Now, as we continue to move up the pyramid, what you will find is that the last three types of studies are very tight in their study design, are highly valid, and can be applied to most clinical cases. And so these are the types of studies that we really seek to find when we are doing our literature searches. And so we have our critically appraised individual articles and our critically appraised topics. And then last but not least, at the top of this pyramid are the systematic reviews and the meta-analyses. And we're going to define all of these research studies throughout the actual module itself, so I won't spend a whole bunch of time here. So we've talked about the levels of evidence, and then so this next slide represents what's called the 6S approach to kind of a search strategy. And so there's studies, synopsis of studies, synthesis, summaries, and then systems, right? And so those are the 6 S's. And so what is it? So we're thinking about your search strategy and what the goal of the search strategy is. Well, it should aim to locate the strongest quality and most relevant evidence first, right? If you could have an ideal research search for articles, right, you would say that I really just want to find the most relevant evidence first. And so how do we do that? Well, when searching for evidence, some study designs, as we talked about on the previous slide, are going to be considered stronger than others, right? And so that would be our meta-analyses, our systematic reviews, and our critical appraisals, right? Those are going to be what we would consider to be the gold standard of evidence-based medicine articles. And so ideally what you want to do is that you want the research design and the research articles that you find to be the most appropriate to answer your clinical question. And so using the 6S pyramid can really help you when you're trying to find the best research evidence and you don't have a whole bunch of time and you don't want to put in a whole bunch of effort. So in the 6S approach, each of the S's in the pyramid are going to basically draw on research evidence from the lower layers. And so this is quite the opposite of the levels of evidence where you actually move from the bottom foundation all the way to the top. With the 6S approach, what you are basically doing is starting at the highest level, which would be the systems, right? And so systems are these electronic systems which can be sophisticated enough to link to patient records and to prompt you, the practitioner, about guidelines for care, right? And so this is more when we're talking about a med school model, right? You go to the doctor, you have, let's say, mononucleosis, and then the doctor gives you a printout on the signs and symptoms and the different types of treatment, right? That would be symptoms, right? That printout would be linked to the pathology that or illness that they put into the system, and then they hand you that printout, right? So we're really going to be working with summaries and moving down the pyramid in the 6S approach. In our summary step, what we're looking at is an outline of management options for a given health issue, and so it's going to provide a summary that incorporates the highest quality and most synthesized resources of research evidence, right? Your synopsis of synthesis summarize the findings and implications of high quality systematic reviews. So you, instead of having 10 systematic reviews, your synopsis of synthesis is really going to be one robust study that takes all of the systematic reviews as it relates to that particular clinical question and lumps them into one clinical research study. Wouldn't that be awesome? Wouldn't that be a great source to use when you're trying to answer a clinical question? As we move down, we have syntheses, which are systematic reviews that provide a rigorous summary of all primary research evidence that can be found. But the big deal is that, remember, there isn't any, what's the right word, summary, right? Or summarization of the results. And so this is where you have multiple systematic reviews. You read each of the recommendations, and based on that group of recommendations, you come up with a solution yourself, right? And so the last two, synopsis of single studies and then studies, provide brief summaries of results. But they really are just that. They're very, very basic. They're not highly referenced. They're not systematic reviews. They're not synopsis of systematic reviews. So these are the lower quality studies that we truly, really don't want to use in an evidence-based practice class. In the 6S approach, what I would say is we want to stay at least at synthesis level all the way to the systems level if we can help it. So as we wrap up this module, number one, what I'm going to say, and I can't believe I'm saying this, is to burn all of your textbooks, right? So yes, are the professors going to be highly upset with me? Absolutely. But the fact of the matter is that a lot of the textbooks that we're currently using are really outdated, right? And so we don't know what information in the textbook is up to date and which one's out of date. And what I will say is that as you learn to search the literature, as you start to gather information, that you need to learn how to organize it. Thank you for listening to this lecture. Looking forward to this semester.